Extract 1. Questions 1 to 12. You hear a nurse talking to a patient called MIHIRAA. You now have 30 seconds to look at the notes.
Good morning, MIHIRAA. Please come in and have a seat.
Good morning, Nurse May. Thank you.
So, MIHIRAA, what brings you in to see me today?
Well, it's about my foot actually. I've noticed a sore on the bottom for the past few weeks, and it's been getting worse.
Can you tell me a bit more about the sore? Is it painful?
Yes, it can be quite throbbing when I put any weight on it.
Righto.
It's also a bit red and swollen around the edges.
Interesting. Have you noticed any drainage or pus coming from the sore?
No, not really. Just some dryness in the area, and it seems a bit deeper than a regular blister.
Okay. And have you experienced any insensibility or tingling in your foot lately?
Now that you mention it, yes, sometimes my toes feel a bit numb, especially at night.
All right, MIHIRAA. Thank you for that information. Now, before we go further, could you tell me a little about your family history?
Yes, unfortunately. My father has had type 2 diabetes for several years now.
I see. And have you yourself been diagnosed with diabetes in the past?
No, not that I know of. But sometimes I do feel very thirsty, and I urinate more frequently than usual.
Those could be signs of undiagnosed diabetes. Now, MIHIRAA, regarding your foot, have you been doing any specific wound care for the sore?
Not really. I've just been trying to keep it clean with regular soap and water.
Okay, that's good. However, for a foot ulcer like this, we need a more specific cleaning regimen.
An ulcer? Is that what this is?
It's certainly a possibility based on your symptoms and family history. Diabetic foot ulcers are common complications, especially when blood sugar levels are not well controlled. The numbness you mentioned can sometimes make it difficult to feel injuries, which can lead to these ulcers. Let me take a closer look at the sore. It appears to be on the ball of your foot. Is that right?
Yes, exactly.
MIHIRAA, have you noticed any recent injuries to your foot, like a cut or a blister?
Not that I can recall. I do wear comfortable shoes, but maybe I've been on my feet a bit too much lately.
It's important to be extra careful with your feet if you have diabetes, even mild or undiagnosed. To get a clearer picture, we might need to do some further tests.
Tests? Like what?
A simple blood test can help check your blood sugar levels and determine if you have diabetes. There are also some painless tests we can do to assess the feeling and circulation in your foot.
Oh, all right. That makes sense.
MIHIRAA, based on the results of the tests, we'll be able to create a personalized treatment plan for you. This might include medication to manage your blood sugar if necessary, special wound dressings, and offloading techniques to take pressure off the ulcer.
What are those techniques?
Those are ways to prevent further pressure on the wound while it heals. It could involve wearing special shoes, inserts, or even using a wheelchair for short periods.
Oh no. That sounds a bit drastic.
It's not, MIHIRAA. It's just to ensure the ulcer heals properly and doesn't worsen. We can discuss the most suitable options for you based on your situation.
Okay, I understand.
Excellent. Now, once we have your test results, we can schedule a follow-up appointment to discuss the plan in detail. In the meantime, continue to clean the wound daily with a mild antiseptic solution and keep it covered with a clean dressing.
Noted, thank you.
Extract 2. Questions 13 to 24. You hear an ophthalmologist talking to a patient called MIHIRAA. You now have 30 seconds to look at the notes.
Good morning, MIHIRAA. Please have a seat. How can I help you today?
Thank you, Dr. Davis. I've been having some trouble with my vision lately. It's quite concerning.
I understand. Could you tell me a little more about these vision problems? When did they start?
Well, it all began about 3 days ago. I was working on a welding project outside, and all of a sudden, everything started to look really bright. It was like staring directly at the sun.
Interesting. Did you feel any pain at the time?
Actually, yes. My eyes felt gritty and sore, almost like someone had thrown sand in them. It was quite uncomfortable.
Noted.
Then, everything started to look hazy. It's like there's a white film covering my vision, especially in the center. Everything seems blurry and washed out.
I see. Can you describe that in more detail? Does it appear constantly, or does it come and go?
That means it is a kind of patchy like clouds moving across my vision. It's worse in sunlight, but it's still there even indoors. It's really affecting my ability to see clearly.
MIHIRAA, do you have any other symptoms besides the blurry vision and the coating? Any redness, watering, or sensitivity to light?
Now that you mention it, my eyes do feel a bit more sensitive to light than usual. They haven't gotten watery, but they are a little red around the rims.
Thank you for that information. What is your occupation, MIHIRAA?
I'm a welder by trade. I work with a lot of bright light and heat throughout the day.
That could be a contributing factor. Have you tried anything to relieve your eye problems since they started?
Honestly, I haven't. I figured it would clear up on its own, but the discomfort is getting worse and my vision seems to be getting blurrier.
It's a good idea to get this checked out. Based on your description, it sounds like you might have a condition called snow blindness.
What? I've never heard of that.
It's a temporary condition caused by exposure to ultraviolet UV light. The intense UV light from welding can damage the cornea. This can lead to the symptoms you described, like blurry vision, pain, and a feeling of something gritty in your eyes.
That sounds exactly like what I'm experiencing. So what can I do about it?
The good news is that your condition is usually temporary. It should heal on its own within a few days. In the meantime, there are some things we can do to help alleviate the discomfort. First, I'd recommend using artificial tears frequently. These will help lubricate your eyes and reduce the feeling of dryness and irritation.
Okay, that makes sense.
Secondly, you'll need to be very careful about light exposure. Wear sunglasses that block UV rays, even indoors, while your eyes heal.
Wearing them indoors sounds strange, but I'll do anything to feel better.
It's important. Additionally, avoid wearing contact lenses for the next few days, and try not to rub your eyes. This can further irritate the eye.
Noted. Is there anything else I can do to speed up the healing process?
MIHIRAA, while there isn't a magic cure, getting plenty of rest can help your body heal faster. You should also avoid any activities that could further irritate your eyes, like welding or working around bright lights.
Unfortunately, I can't really take time off work. Is there anything safe I can do to protect my eyes while I'm welding?
Absolutely. Using a welding helmet with the appropriate filter is crucial. Make sure it's in good condition and the filter is the correct shade for the type of welding you're doing.
I'll double-check it for sure.
That is the end of Part A. Now check the answers.